Wait a minute. Good afternoon, and thank you for joining this virtual briefing entitled Addressing the Impact of COVID-19 on Seniors and Individuals with Disabilities, held by the Committee on Education and Labor. I hope you and your loved ones are healthy and are doing well. I want to remind everyone that this briefing is a public-facing event. A recording of the audio and video of the briefing will be made available to the press and the public shortly after it concludes. I want to note that we invited the minority colleagues to the briefing, but we're informed that they do not intend to participate. However, the briefing is still open to all committee members, and we continue to invite all of our colleagues to participate today. As this is not an official committee activity, there is no official record of this activity. Any member who wishes to share a relevant statement, article, letter, or other item may do so by way of their personal office's communication methods. I also want to remind members to please keep your microphones muted and your video cameras turned off unless you're speaking, at which time you need to turn on your camera and microphones. And please remember to turn them off once again when you are finished. If any member is using a telephone, audio only, *6 will unmute and remute your phones. If anyone is experiencing any trouble connecting during the briefing, please contact the committee's IT Director, Sheila Havener, or the Chief Clerk, Talise Ali, by email or phone. Their emails and addresses, their email addresses and phone numbers were sent out with the notice for the briefing. To begin the briefing, the clerk will conduct a roll call, and this is simply to get a sense of who is on the call at this time. Members, please remember to unmute yourself when you respond to the roll call. Madam Clerk, please call the roll.
Chairman Scott.
Present.
Mrs. Davis.
Present.
Mr. Grijalva. Mr. Courtney.
Present.
Ms. Fudge. Mr. Sablon.
Present.
Ms. Wilson. Ms. Bonamici.
Present.
Mr. Takano.
Present.
Ms. Adams. Mr. DeSaulnier. Mr. Norcross. Ms. Jayapal. Mr. Morelli.
Present.
Ms. Wild.
And
Mr. Harder. Mrs. McBath. Ms. Schreier. Ms. Underwood.
present.
Thank you. Mrs. Hayes.
Present.
Ms. Shalala. Mr. Levin.
Here.
Ms. Omar. Mr. Trone. Ms. Stevens. Mrs. Lee.
Present.
Mrs. Trahan.
Present.
Mr. Castro. Mrs. Fox. Mr. Rowe. Mr. Thompson. Mr. Wahlberg. Mr. Guthrie. Mr. Byrne. Mr. Grothman. Ms. Stefanik. Mr. Allen. Mr. Smucker. Mr. Banks. Mr. Walker. Mr. Comer. Mr. Klein. Mr. Fulcher. Mr. Watkins, Mr. Wright, Mr. Muser, Mr. Johnson, Mr. Keller, Mr. Murphy, Mr. Van Drew. Chairman Scott, this concludes the roll call.
This is Kim Schreier. Can you hear me?
Yes, Rep. Schreier, I can hear you.
Thank you. I'm on too.
Okay.
Did we miss anybody else?
Rep. Stevens is also on. Haley Stevens.
Good, thank you.
Thank you.
Thank you. In a minute, we'll hear from our distinguished experts, and after our experts finish their presentations, we'll open the floor for members for them to ask questions. Since we're getting used to this platform, and as this is an informal committee briefing, I'm going to try something today that Dr. Adams successfully used in last week's Workforce Protection Subcommittee hearing, and that is, instead of recognizing members in order of seniority, I'll recognize members in order in which they seek recognition to ask a question by indicating they have a question in the chat box. Members using the telephone with audio only should have to have a member of their staff indicate their interest in the chat box on their behalf. Again, if you wish to ask a question, please indicate so in the chat box or have a staff do so for you. This briefing is limited to 1 hour, and we're very pleased to have experts on hand who have made themselves available to discuss this issue with us. Members are advised to ask questions succinctly, and please be considerate of other members waiting in the queue to ask questions. A chime will sound as a reminder to members to wrap up their questions. I now recognize myself for a brief opening statement and to introduce the experts. COVID-19 pandemic is affecting the lives and livelihoods of all Americans, but the impact has been particularly severe for seniors and people with disabilities. The CDC reports that those aged 65 years or older account for nearly 80% of the COVID-19 deaths. And in New York, which is the epicenter of the pandemic in the United States, the fertility rate for individuals with intellectual and developmental disabilities is more than twice the state's overall fertility rate. Long-term care facilities, which typically provide a safe environment for millions of aging Americans and Americans with disabilities, have experienced widespread infections, resulting in tragic deaths of residents and workers. Meanwhile, family, home, and community care workers are fighting on the front lines of this pandemic without the training, resources, or enforceable workplace standards necessary to keep themselves and their patients safe. Congress has delivered urgent relief for seniors, individuals with disabilities, and workers who care for them in recent COVID-19 response packages. However, as we recognized with the passing of the HEROES Act on Friday, Congress must secure additional relief for seniors, people with disabilities, and their care providers. And so I now want to recognize and thank Charlene McSpadden and Kelly Buckland, who are joining us today to discuss how the pandemic is disproportionately hurting aging and disabled Americans, what Congress has done to provide them relief, and what Congress must still do to help these communities get through this crisis. Ms. McSpadden has nearly 30 years of experience providing services to people with disabilities and seniors, and serves as the Executive Director of the Department of Disability and Aging Services for the City and County of San Francisco. Mr. Buckland has been actively involved in disabilities issues since 1979 and currently serves as the Executive Director of the National Council on Independent Living. I thank you both for being with us today, and now I'll turn the program over to you for a few words, and afterwards we'll take questions from our members. First, Ms. McSpadden.
So I want to thank the leadership and members of the Education and Labor Committee for the opportunity to talk with you today regarding the Aging Network's response to the COVID-19 pandemic. My name is Shireen McSpadden. I'm the Executive Director of the San Francisco Department of Aging and Disability and Aging Services. My department is the designated area agency on aging for San Francisco and also part of the county's welfare agency. Each year, my department serves almost 70,000 seniors, adults with disabilities, and caregivers directly and through partnerships with community providers. I also serve as the president of the California Association of Area Agencies on Aging. Area agencies on aging are tasked by the Older Americans Act with planning for the needs of older adults within a local community. We are responsible for developing a coordinated service system that supports older people to reside safely at home instead of institutional settings. We promote health and safety and provide opportunities for people to connect and remain engaged in their communities. Our community-based services work in tandem with county programs like Adult Protective Services, as well as healthcare systems. These responsibilities have become all the more important during the COVID-19 pandemic. In recent weeks, we have worked quickly and in close partnership with our community providers to adjust our service models in order to sustain and expand resources that support seniors to safely shelter in place. I would like to highlight some of those efforts for you. Our community services programs have gone virtual, offering exercise classes, choir rehearsals, and art classes that are usually held at senior centers as online hangouts via Zoom. We have developed new ways to check in on people and make sure they are doing okay, since we don't get to see them each day. We're still providing critical services at home, such as adult protective services, occupational therapy, and in-home care. California has a robust in-home care waiver program for Medicaid recipients who would otherwise need institutional care. Half of all COVID-19 deaths in California to date have occurred in nursing homes. This community-based system of care will be even more vital in the coming 18 to 24 months as administrators work to ensure safe distancing of their residents. In San Francisco, we have instituted a system to triage needs, and we have enhanced the resources available for when people's home care workers are unavailable due to illness or their own status as an at-risk population. However, the number one need that we are seeing statewide is food support. We know that older adults already faced food insecurity at high rates, and COVID-19 has only exacerbated these needs. For example, in San Francisco, we typically serve 25,000 senior and disability meals per month. Since the pandemic began, we are now serving an additional 100,000 meals each month, meaning that we have had to accommodate a 40% increase in service delivery almost overnight. Our congregate meal programs across the state have transitioned to new approaches that incorporate social distancing precautions. These communal dining services have become meals to go and home delivery. Where possible, we are distributing multi-day packs of meals instead of single meals to minimize contact and exposure. We have expanded our traditional home delivered meal program and are implementing new models to bring food to people. California Governor Gavin Newsom has established Great Plates Delivered, a short-term program through which local administrators can partner with restaurants to provide up to 3 meals daily to at-risk seniors. I'm proud to say San Francisco is launching this program today. Our ability to make these changes is tied to congressional actions. The Aging Network is very appreciative of the support that Congress has provided thus far, including support of older adults' safety and independence through the reauthorization of the Older Americans Act in March, the emergency funding for nutrition services provided via the Families First and CARES Acts, and funding for additional supportive services, family caregiver supports, and ombudsman and elder justice activities included in the CARES Act. In particular, I want to note that the increased flexibility that allows us to move Older Americans Act funding between service areas during the pandemic has been vital in allowing us to act in the ways I've described. We also appreciate that the HEROES Act includes additional funding for the Aging Network to deliver a wide range of services, and we're committed to working with members of Congress to ensure that Congress continues to respond to critical needs during this crisis. We are at a pivotal moment in aging services. COVID-19 has brought to light strengths and gaps in a new way. We face significant challenges in the months ahead. In addition to food insecurity, social isolation will be a prevalent issue. Prior to COVID-19, we strove to bring people out of their homes to congregate and socialize. However, even as the country opens back up, older adults will likely be asked to stay at home as much as possible to minimize their risk. That means we have to reimagine our entire service delivery system. We will have to find new and efficient ways to deliver services and build partnerships. We will look to Congress for continued support so that we can achieve this. There are 3 key areas I'd like to highlight. Fundamentally, we know that state and local revenues that help sustain our services will be significantly impacted. We need to make sure that older adults, the aging network that supports them to safely live in the community and age with dignity, is adequately prioritized in federal discussions and future COVID relief packages. One specific area that we must prioritize is leveraging technology to address and mitigate social isolation. Isolation has been identified as a public health issue. Among older adults, social isolation is connected to higher rates of abuse, risky health behavior, depression, and entering institutional care. Targeted funding for the aging network to purchase and disseminate technology, such as tablets and assistive devices, would allow low-income older adults to stay connected to loved ones, doctors, and community resources, and to participate in health and wellness activities online. Another critical area is the aging network workforce and its access to personal protective equipment and scarce resources. While we recognize that healthcare systems must have prioritized access, many aging network professionals are on the front lines of providing personal care and direct in-home services. In closing, I want to reflect that within this turbulent time, there are also opportunities. The aging network is stepping outside of the box to try new things and develop creative and innovative services to meet the needs of our aging community members. And we are seeing people think about their older neighbors and ask questions about resources and service systems in ways they were not before. People want to get involved and they want to help. It's so encouraging as a professional with 30 years of experience in aging and disability services to see this interest and commitment. With their partnership and coordination across federal, state, and local government, I'm confident that we will rise to the challenges we face.
Well, thank you very much, Ms. McSpadden. And we'll now go to Mr. Buckland. And before he comes on, there are a couple of people that are not muted. If you could mute, there's a little background noise with several of the people. Mr. Buckland.
Thank you, Chairman Scott. I've submitted my comments in writing because I'm probably not going to, they're a little lengthy, so I'm probably not going to get to present all of them. And before I start with my comments, I also want to thank the committee for having me, and thank you for allowing me this opportunity to highlight some of the disparities that people with disabilities have faced. And to give you a little bit of information about me before I start, I am a person with a disability. I've been a quadriplegic and have used a wheelchair for just about 50 years now. And so I'm also old at this point. So we have, as Ms. McSpadden has talked about, seen a whole new light on how people with disabilities and for that matter, elderly people have been treated. And this virus has just sort of highlighted some of those disparities. I'll begin by stating that what most of you probably already know, and that is that people with disabilities and seniors make up the majority of the deaths caused by the virus. Many of these deaths occur in a nursing home and other congregate settings for people with disabilities. And in fact, as you stated, Mr. Chairman, according to the New York Times, more than 1/3 of all the deaths in the United States from the virus have been among people with disabilities and seniors who live in congregate settings. The average age of death from the virus in the United States is the age of 75. In Louisiana, the death of April Dunn, a disabled Black woman who was chair of the Louisiana Disabilities Developmental Disabilities Council, has been widely publicized. What has garnered less media attention, however, is that in Louisiana, more than 70% of the people who have died from COVID-19 have been Black, even though Black people are less than 1/3 of the state's population. I bring these up because I think there's a disparate impact on people with disabilities, and especially people of color with disabilities. Between 1999 and 2008, the nationwide average of admissions in the nursing home for white people went down by 10%, and it went up 10% for Black people. Additionally, over 60% of the staff who provide direct support in institutional settings are Black, Indigenous, or other people of color. The intersections of race and disability in COVID-19 also occurs outside of the institutional settings, and we have significant documentation about that. So, ironically, I think that the general public now considers community life the safe haven instead of institutions and nursing homes. The disability rights community and people with disabilities have always known this, but combating the public perception that people get 24/7 care in an institution has been difficult. In an average year, Centers for Independent Living transition approximately 4,000 people from nursing homes and other institutions back into the community. Unfortunately, these institutions not allowing visitors, the lack of personal protection equipment, direct worker shortages, and the lack of affordable and accessible housing is hampering their efforts. Social workers and nurses are often, quote, too busy, unquote, to help answer questions, transmit documents, etc. And timely follow through with ordering durable medical equipment and or prescribed medications is poor, putting people at risk on the date of discharge. No or limited COVID-19 testing of residents before admission and at discharge, and not providing personal protection equipment is also problematic. Without adequate long-range funding under Money Follows the Person and other in-home community-based services waivers, it is nearly impossible to cover the initial cost to assist with transitioning people with disabilities out of institutional settings. However, because of their determination and creativity, Centers for Independent Living are still transitioning people from these institutionals back into the community by working with ombudsmen and social workers to provide transitional services via phone and online web meetings. The transition plans, or I should say, when transmission plans and other documents need to be signed, centers use DocuSign or secure fax. They are also very focused on keeping people out of the institutions. CILs have been calling their consumers to do wellness checks, see how they're doing, determine if they need services to stay in their home, provide information about the virus and available services, and just to provide general information. They are also using email, online platforms, or in-person meetings to provide this information. CILs are also ensuring people with disabilities have emergency plans and understand their rights and COVID-19 risks, and that COVID-19 materials are available in formats accessible to people with disabilities. CILs are using CARES funding to assist with food and hot meal delivery, either directly or in partnership with food banks and other social service agencies. Funding for food programs and expansion of home delivered meals has focused mostly on adults over the age of 65. And while this has been extremely helpful for self-isolating seniors over that age, there has been little funding for younger and middle-aged people with disabilities or with chronic health conditions. This puts them at risk for being institutionalized. They often can't access grab-and-go meal distribution sites because they don't drive or have anyone to drive them there, even if they have access to personal protective equipment. CILs are also using CARES Act funding to provide rent or utility assistance, paying for emergency backup, direct care workers, PPE, paper products, and other services that keep people in the community. However, the front door to nursing homes and other institutions are still open. It's hard for me to believe or understand how anyone still believes that this is a safe place to send people. I also want to highlight a couple of things we've done on the national level. The National Council on Independent Living has worked with the healthcare company Centene to develop a web video series for medical providers that address the pandemic and people with disabilities. One video is focused on just providing access to services for people with disabilities. The second one focused on personal assistance services or in-home services. A third video focused on medical racking, and the fourth is on telehealth and making it accessible to people with disabilities. Again, these videos were completed to make services more accessible to people with disabilities. Additional measures are needed to ensure that federal programs such as Money Follows the Person that are designed to transition people from institutional settings to independence, and the barriers to Black referrals from participating are needed on a systemic level. And finally, the health and safety of direct support professionals and personal assistance providers who provide these services really need to be prioritized and budgeted for accordingly. Overtime must be provided to cut down on the number of providers coming into someone's home and allow more social distancing. Hazard pay needs to be provided because many of these people are putting their lives on the line to provide services to allow people to stay in their own homes. And personal protective equipment needs need to be provided to the staff and consumers as well. Thank you, Mr. Chairman. I would stand open for any questions.
Well, thank you very much. Your testimony has been very helpful. And now we'll go to questions. I see in the chat box we have Ms. Bonamici, Ms. Underwood, Mr. Morelli, and Mr. Saplan in that order. To begin with, Ms. Bonamici.
Thank you very much, Mr. Chairman, and thank you to the witnesses for your helpful testimony. I'm going to start with a question for Ms. McSpadden. I'll put it into two parts. I was proud to lead the passage of the Older Americans Act, where we did put significant focus on social isolation. And we know that these measures have been taken to minimize the spread, but I'm also really concerned, as you brought up, about the consequences for older adults who already face high rates of social isolation, particularly those in the LGBTQ community disproportionately. So I want you to expand a little bit on that and how we can mitigate that, but also could you talk about the role of the long-term care ombudsman program, because there was some misinterpretation, I think, and misunderstanding about access during the pandemic that created some confusion that led to some of the people being ombudsmen being barred from facilities. And, you know, we did put provisions in the CARES Act to clarify that. So I want to make sure that we hear from you about how that's working and the importance of that. And then I have a question as well for Mr. Buckland after you respond.
Thank you. And I just want to thank you for your leadership. The Older Americans Act is so important for all of our older adults in the United States. So I very much appreciate that. So to start with the first question you asked, yes, we're very concerned at all levels of government about, in the aging network, about people socially isolating. And technology is really an important piece of making sure that we can reach out to people. We also have in San Francisco a program called the Friendship Line, which is a way that we can reach out to older adults through that nonprofit partnership, and also people can call in. So it's a warm line where calls can go out and come in. Things like that are really important. And at the same time, it's really challenging. I happened to be on earlier and I got to hear some people talking about technology and what a pain it is. And it's really hard sometimes for older adults who haven't been able to use technology and don't have it in their homes to be able to engage that way. And so we're really trying to figure out what the best ways to get technology into people's homes that's simple, and figure out at the same time how to safe distance and keep people safe and yet provide them with access. So I know there are a lot of local programs like that. We're hoping that at some point there'll be a way that federal government can help pay for some of those things. That's certainly a wish I would have. And thinking about LGBTQ populations specifically, I can say what we've done in San Francisco is we have an LGBTQ senior task force, and it started meeting again bi-weekly just to keep tabs on organizations that are serving those populations, finding out what their challenges are, trying to help address some of the needs. And they've also put together a model for a new program that provides clinical care for people who need something beyond just a friendly call. Somebody who, people who need more information.
Right. I don't want to cut you off, but if you could just say just real quickly about the long-term care, and then before you do that, I just want to say, Mr. Buckland, thank you so much. I do want to hear from Ms. McSpadden quickly, but I want you to address, we know the concerns already about the institutional bias for adults with disabilities are being sort of put on, if they're Medicaid eligible, put on wait lists for nursing homes when in fact they could be better off in community care. So can you talk a little bit about that in just a brief sentence or two? Ms. McSpadden, importance of long-term care ombudsman.
Yes, it's really important times like this, of course, and it's still a challenge for our ombudsman volunteers to get into places, but we have figured out electronic solutions.
Terrific. Good. Thank you so much. Mr. Buckland, how can we overcome and would dedicated funding for Medicaid home and community-based services, would that help address the crisis, but also the institutional bias that puts more people into nursing homes when they really would be better off elsewhere.
Thank you, Congresswoman Bonamici, and you're exactly right. The institutional bias is alive and well, and it's keeping a lot of people from living in this or in the community and institutionalizing folks. Providing HCBS services absolutely would help alleviate some of that, but at the same time, I think we have to close the front door. We have to change public perceptions about people getting 24/7 care in institutions, because it's just simply not true, and their life expectancy is cut shorter when they're in institutions. So we have to somehow change public perception and the whole bias thing that surrounds it, and really teach people that it's actually safer to live in the community and to get better services.
And I thank you, Mr. Chairman, for your patience. I've gone over my time, but I very much appreciate both of our witnesses today.
Well,
and I yield.
thank you, and thank you for your leadership in the Older Americans Act. Ms.
I
Underwood.
appreciate that, Mr. Chairman.
Ms. Underwood.
Thank you, Mr. Chairman, and thank you to our witnesses, Ms. McSpadden and Mr. Buckland. Mr. Buckland, the HEROES Act, which I proudly voted for on Friday, included funding to ensure that absentee ballots and related voting materials are accessible for individuals with disabilities. In light of a pandemic that can make in-person voting highly dangerous, what specific steps do we need to take now to ensure that one of the most fundamental rights of our democracy is protected for people with disabilities in the general election?
Thank you. Thank you. Thank you. First of all, thanks for your vote on the HEROES Act. And secondly, thanks for bringing up the election stuff. This is so important. I think a lot of people have not seen how important this is for us. And the move to vote by mail, paper ballot is going to disenfranchise so many people with disabilities because they either don't have the ability to fill the ballot out or then cast it. And the thinking is like, so it's too dangerous for everybody else to go to the polls, but people with disabilities, that's the only place you can gain access. So that's where you have to go. It's sort of reversed. It should be the other way around. So what we have to do, and what's in the bill, actually, I'd like to see a little bit better, more distinct language about it, but we need a way to electronically receive the ballot, electronically fill it out, and electronically cast it. The one part of the HEROES Act that says that we can use and that's already available to overseas military folks was a great thing, because West Virginia passed a bill that did virtually the same thing, and it would allow us to do that electronic casting that's already available to the folks in the military overseas. So again, thank you very much, and it's really an important part of the bill, and I really appreciate it.
Thank you, Mr. Buckland, so much. Ms. McSpadden, the pandemic has heightened the effect of existing policies that undervalue the work of caregivers. Can you tell us more about the unique risks and challenges that caregivers are facing right now, and what changes are needed in order to address them? Thank you.
Yes, caregivers are already at risk because they tend to live in poverty. They don't get paid a lot. It's certainly one of the hardest jobs to do, and yet they're not compensated in the way that they should be. But also right now they're at heightened risk because they can expose the person they're caring for. They can be exposed themselves, and the system really relies on the number of people who are showing up every day to be caregivers. A number of people obviously are family caregivers, and it's just a really important system to support. One of the biggest problems we have right now is accessing personal protective equipment for caregivers, and without that, they can't really keep the person they're serving safe. And as Mr. Buckland mentioned, living in the community is really the best way. It's much safer right now, especially given COVID, much safer than living in nursing homes. So we really need that personal protective equipment.
Well, thank you to the witnesses for your testimony today and for your incredible work. And I really appreciate your time. Mr. Chairman, I yield back.
Thank you. Thank you. Mr. Morelli.
Yes, thank you, Mr. Chairman, for the opportunity to gather folks remotely and discuss the impact of COVID on seniors and individuals with disabilities. I also want to thank Ms. McSpadden and Mr. Buckland for being here to share your thoughts and your experiences. Over the last couple of months, as we've come to terms with the pandemic, I've talked to countless constituents, business owners, advocacy groups, and local stakeholders here in Rochester, New York. And actually, we meet daily remotely with community-based organizations and state, county, and city governments. One of the efforts I lead to talk daily with one another so we can coordinate what our activities are, and including the groups are organizations that support people with disabilities, as well as an organization called Lifespan, which is one of the region's top caregiver for senior citizens. So we remain committed to the impact on seniors and those individuals with disabilities. And this is particularly difficult, obviously. The reauthorization of the Older Americans Act, one of the issues we focused on was addressing the health impacts among older adults. So I do want to appreciate, just say that I appreciate Ms. Bonamici's question regarding electronic access for people, the digital divide, and how do we continue to keep people connected even when they're feeling isolated. But along those lines, and maybe this is for you, Ms. McSpadden, can you talk a little bit about the capacity for mental health services, even if people aren't able to deal with FaceTime or Zoom? Are you hearing about people being able to consult with mental health care professionals telephonically? What more could we and should we be doing in this space? We're obviously rightly concerned about the isolation, and for people who are already facing challenges, this time has got to be even more. And this would certainly, I'd certainly pass that question along to Mr. Buckland as well.
So I would say that we actually are facing a shortage of mental health clinicians who really understand the intersection between mental health and aging. And this is a time when we really need it. It's also, I think, challenging for older adults to move into a telehealth model. We certainly have people who are very comfortable with it, but there are a number of people who are not. And so we are challenged with figuring out how we get people more comfortable with it, knowing that we're going to need to make that happen over the next 18 to 24 months.
Yeah.
So thank you, Congressman Morelli. We have some of the same thinking. There is a lack of computers and internet access for people with disabilities. And so, the good thing about the CARES Act was it allowed enough flexibility that some of the centers for independent living are actually purchasing devices and providing hotspots for people. And there is some mental health work going on virtually, but some of the programs, because of their insecurity or their perceived insecurity, like Zoom, there's a hesitancy to do that because of concerns about HIPAA and that sort of thing. So I think that is also out there. There's concerns about using the platforms, and then there's obviously the lack of access to them.
Well, I appreciate both your comments. I think we need to continue to work on expanding access. So appreciate all you do. And Mr. Chairman, I appreciate you holding this hearing and giving me an opportunity to speak, and I yield back. So.
Thank you. Thank you. Mr. Sablon will be followed by Ms. Wild, Ms. Lee, and Mr. Hahn. Mr. Sablon.
Yeah, thank you very much, Mr. Chairman, for holding this hearing, and Ms. McSpadden and Mr. Buckland, thank you for your testimonies today. I am also an individual with a disability. I was chairman of our state rehabilitation council at one time when I was your age, much younger. And so I do make, I have a town hall meeting with our aging center program, those in the congregates, and my wife would come out and share food baskets for each of the participants, both in the congregate and the home delivery meals. My wife and I occasionally visit our Center for Independent Living, and the director was actually very happy that she got a little bit of money where she planned to buy computers or notepads, laptops for those individuals, so she could continue working with her clients. But disabled adults experience poverty at nearly twice the rate of their disabled counterparts, at least in my district in the Northern Mariana Islands. So mostly of the adults who participate in the programs are on either on disability or either on small pensions. But poverty rates are even higher for disabled women and people of color. How has this impaired the ability of people with disabilities to respond to this pandemic? And have you heard about people having issues related to having the resources to stockpile the medications they need? Either one. I can't hear you, Ms. McSpadden.
I was going to defer to Mr. Buckland to answer that question because I think it was more focused on people with disabilities. Am I right?
Yes.
Again, I think I responded or sort of addressed this in the previous comments, but there's definitely a lack of that sort of those devices. And we have seen some centers purchasing those and providing hotspots so that people can have better access. Was that your question? Did I address it correctly?
Yeah, well, partly. It's just that, like I said, the director of the Independent Council, Living Council Center was asking for a little bit of money to buy her participants a way to communicate so that the participants in this in her center would be able to communicate. See, I come from a place where there's 3 separate islands, and so individuals have to get together and participate in the daily programs. To be honest, my wife and I started gardening after learning that participants on the Independent Living Council, our center, actually started gardening themselves. So, well, my time's up. Thank you very much for joining us today, and we appreciate continued help to our constituents. Thank you.
Okay, thank you. Next will be Ms. Wild. Ms. Wild? Are you muted?
Sorry about that.
Okay.
I was that person. Thank you so much for having this hearing. And Ms. McSpadden, I was very happy to hear you talk about food insecurity. It's been one of my major concerns for seniors, and it's why I introduced the Combating Hunger for Older Americans During Coronavirus Crisis Act, along with Dr. Rowe, who's also on this committee, to allow HHS to transfer funds from congregate meal plans to at-home delivery. But I want to ask you on a different issue. I'd like to ask you to speak to the importance of large number of tests, COVID tests, being supplied to nursing homes and long-term care facilities on a regular basis, especially in light of asymptomatic transmission, so that we can do broad sweeps and surveillance of both residents and workers. And I guess in addition to testing, I'd like you to comment on what risk we might run if we don't allow healthcare workers to self-quarantine and get paid leave when they've been in contact with somebody who's confirmed to have COVID-19. In the interest of time, I'm going to stop there and just ask you for your comments on both testing and the importance of paid leave in this context.
I would agree that both of those are important. And in California, there's a lot of advocacy to push the state to require that testing happen and testing happen on a regular basis. I know in San Francisco, our health director is requiring that all skilled nursing facilities have regular testing.
What do you mean by regular? Like, how often do you think that should be?
I don't, I'm not a health professional, and so I don't actually know how often it should be, but I know that that is being figured out at the state level right now, and that the state health department is figuring out exactly what those recommendations should look like for counties. And I'm not sure exactly where they are yet on that.
I know it's a difficult issue because, of course, the staff members go home and spend time with their families and that kind of thing, and could very well bring an infection back to the facility right after they've received a test that's negative. So, so speaking about the issue of paid leave, if they know they've come into contact with somebody, do you have any thoughts on that?
Yes, I think paid leave is extremely important for this workforce. I absolutely think so. I think it's important for home care workers. I think it's important for skilled nursing facility and assisted living workers. And without it, people can't afford to stay home.
And are more likely to just go back to work and possibly transmit the illness. Thank you so much. I really appreciate the work that you're doing.
Thank you.
I yield back.
On behalf of the others on the list, they appreciate it. Thank you very much.
Thank you.
Ms. Lee.
Thank you, Mr. Chairman. I want to thank Ms. McSpadden and Mr. Buckland for your work on behalf of our communities, these communities. This is a very personal issue, having a mother who is in an assisted living memory facility and not having been able to see her since early February. And so understanding the importance of, or just the impact on mental health and the isolation and what it has, not just on mental health, but their overall health is incredibly important. Ms. McSpadden, I introduced legislation that would implement automatic triggers to increase the federal medical assistance percentage based on each state's unemployment. That bill just passed as part of the HEROES Act, which increases the federal payments to state Medicaid programs by an additional 10 percentage points starting July 1st, 2020 through June 30th, 2021. This will support activities that strengthen home and community-based services. Could you talk about the importance of providing robust funding for FMAP, specifically the types of home and community-based services that need greater funding within the context of this pandemic?
Yes, absolutely. And I can give an example in California. In California, our governor just came out with the May revise, and because we are expecting so many more people to go onto Medi-Cal, California's Medicaid program, a lot of the optional benefits are being stripped out. And without additional funding, we won't be able to offer those optional benefits. Two of them that are really important for older adults are the multi-purpose senior services program and what we call CBAS, which is adult day health. And those are two systems that actually help keep people out of nursing homes, and are real, in my opinion, are very, very important programs. So the FMAP, the additional FMAP dollars would really help restore programs like that to California. So I appreciate your leadership on that.
Yeah, incredibly important programs, especially at this time, knowing how at risk individuals are in nursing homes. So doing what we can to keep them out is important. Also, as you know, Congress provided additional funding and flexibility to support the ongoing operation of the Older Americans Act programs during COVID-19. Can you share how this additional funding and flexibility has been working so far? And then also, what further action do you feel Congress is needed from Congress?
Well, as I mentioned in my remarks, one of the things that we're seeing is just incredible food insecurity and an increased need for home delivered meals and for the congregate meals that have been turned into home delivered meals. The flexibility has been really helpful. The infusion of dollars to these programs that are really trying their best to build their capacity and meet the need has been extremely helpful and important. I think one thing that we see is that older adults are going to hopefully continue to stay at home, for a very long period of time. We're going to need extra dollars to continue providing the very important meals that we're providing. Also, I think that those dollars have helped with some of the isolation issues that people are facing. We are much needed.
Great, thank you. I yield. Thank you, Mr. Chairman.
Thank you. We're getting close to the end. I have Ms. Trahan, Ms. Davis, and Mr. Chicano in the next 7 minutes. So Ms. Trahan.
Thank you so much, Mr. Chairman, and thank you to the terrific panel. This is so helpful. Some of what you're doing is confirming our instincts, but I've learned a bunch while I've been sitting and listening as well. My question is for both Ms. McSpadden and Mr. Buckland. There's no question that COVID-19 has taken a devastating toll on our seniors and people with disabilities. In Massachusetts, 60% of the COVID-19 related deaths have happened in skilled nursing facilities or assisted living facilities. In part, this is due to the prevalence of underlying health conditions that lead to worse outcomes for those who contract COVID-19, but it can also be due to poor containment measures and planning to halt the spread of illness in congregate settings where people need long-term care, such as senior nursing homes. House Democrats clearly voted to advance the HEROES Act last Friday, including funding to establish nurse strike teams, improve safety and quality protections for patients, and require data collection for COVID-19. And I do believe we have the dual obligation of getting these facilities the resources they need, of which FMAP has been crucial. But we also have to strengthen accountability. Especially in the face of so many deregulatory measures under this administration. So I have a two-part question. One is, can you speak more to the lessons learned these past 2 months regarding the vulnerabilities of seniors who are living in nursing homes? And beyond the provisions in HEROES, what else do we need to do? And then as we consider future packages, how should we be thinking, how should we as legislators be thinking in terms of conducting oversight to strengthen accountability measures to protect seniors as well as the staff?
I can start, and I would say that an investment, and then the second question you asked was protecting staff.
Yeah, or just accountability measures. There are. I've written letters to CMS. It's clear to me that you can do everything right and you can still have an outbreak. But we've had some that have lacked transparency, communication, turned away the National Guard from doing testing. What else needs to be done in terms of legislative action to enforce accountability measures?
I would say that might be a little bit out of my purview, the answer to that question.
I can try to talk about that. I think there's been a huge lack of transparency, and I think what we need is more funding for people to stay in the community, first of all. We need to change public perception, as I mentioned before. And frankly, when you look at how systems are funded, the Medicaid system, you have an absolute right to stay in a nursing home and have it paid for by Medicaid. Staying in the community is optional. States can either do that or not do that. We need to level the playing field and make living in the community just as much of a right as living in an institution. So that's one of the things. And then the other thing is, I'm really concerned about some of the efforts to give immunity to nursing homes. Yeah. And I would really ask that you not.
I have just a couple of minutes. I'm going to ask Ms. Davis and Mr. Takano to ask their questions, both ask their questions, and then get answers to both of them, starting with Ms. Davis.
Thank you. Thanks so much, both of you, for being with us. We talked about issues of bias, but I wonder if you could address the idea that in many cases, we hear about the rationing of health care during this pandemic. And I wonder if you could speak to that. I know, Mr. Buckland, you're well aware of the Office of Civil Rights clarification that rationing of care, of course, is based on disability is a violation of civil rights. Could you comment, though, where are you seeing this? Is it obvious? Is there something that's really difficult to see?
I think it's been really hard to see.
If you could hold and wait until the next question is asked. Was that your question?
Okay.
Davis?
I also have a quick one really from Ms. McSpadden, and it just refers to the workforce that's needed. And I know we did talk about that as well, that caregivers are at risk. But what about the staffing where we really need to make sure that we have people who represent the community that are there, the recruiting and obvious answers of the fact that they're not paid well enough? Thank you.
Okay, and we'll ask Mr. Takano to pose his questions and ask our experts to respond to both of them at the same time. Mark?
Hi, Ms. McSpadden. I'm hearing that that nursing homes may only have, many of them only have one doctor, and that doctor may not have expertise in infection control. And that not only is there a shortage, but even the professional staff, like the doctor level, may not have sufficient training to be able to respond to the COVID-19 challenge. I also pose the question about whether or not we need to have a national priority put on these nursing homes for testing of staff and residents, as well as training and then infection control.
Thank you very much. And if you could respond to both of those, our time has really expired, but if you could respond to both of those questions, we'd appreciate it.
Okay, well, I'll start and say that we have a shortage of workforce for older adults across the span. So anything that you could do related to that would be very helpful. In terms of the infection control issue, I agree with you that it'd be really helpful to have training and so that people in nursing homes and staff in nursing homes or the doctors get either partner with somebody so that they can share that knowledge, or that they get training so that they can respond the way they should.
And Mr. Chairman, I know we're running out of time, or we ran out of time, so I'll take the one about the rationing of services and the civil rights violations. That is a violation of rights laws, and we were very concerned when we saw that in some of the states. So we did see good outcomes from the Office of Civil Rights and the agreements that they reached with those states, but we're still concerned about that occurring in other states, especially if there's a resurgence of this virus due to a second wave. We're just really kind of, at this point, it sort of has not been as big of a problem as when we were peaking, but we're keeping an eye on that in case of a second surge, and would be still concerned about it.
Well, thank you. And I want to thank our witnesses for being with us today. This information is extremely helpful, and we're going to pursue as much assistance for the seniors and persons with disabilities as we can. Thank you so much, Ms. McSpadden and Mr. Buckland, for being with us today. And I regret we had others questions for you, but we have a conference call right now. So we appreciate you being with us today and look forward. We may have follow-up questions to pose to you, and we appreciate your availability to respond to those questions. So thank you very much. Is there anything else to come before the committee? If not, the committee is now adjourned. Thank you so much.
Thank you, Mr. Chair.
Okay.